talk about Medicare and Medicaid and what the differences are, and make sure you're getting all the benefits you're entitled to. So if you're new to my channel, my name is Ed Weir. I'm a former manager of the Social Security Administration. I ran the third busiest Social Security office in the country, and before that, I actually worked for the Department of Social Services doing Medicaid. And many moons ago, when I had actually probably less hair, I was a sergeant in the Marine Corps. So, all right, let's go ahead and get started. And this is a live broadcast. So if you have any questions about all things Social Security, retirement, disability, survivor benefits, spouse benefits, Medicare, Medicaid, the Affordable Care Act marketplace, make sure you type it in the chat. And then the first part on the difference, topic of the day, how this works, I do a topic of the day, and today's Medicare, Medicaid. And then once I talk about that, then I will open it up to the floor and all the questions you have, and I'll answer as many questions as I can within about an hour or so. All right, so type your questions in there and I'll get to them. Okay, so we're going to talk about Medicare, Medicaid. We'll talk about the Medicare Savings Program, which saves a lot of people, millions of people, money throughout the country. We're going to talk about Medicaid unwinding and what you do before you turn 65 in terms of Medicare. We're going to talk about some fraud going out there. People not doing the right thing. So, okay, so Medicare. Medicare is a federal program. So you sign up for Medicare at the Social Security Administration. I've signed hundreds of thousands of people up for Medicare throughout my career. So you go into Social Security and you sign up. You sign up for Part A and Part B. When do you get those? You get those at 65 years old. If you're already receiving monthly benefits, you don't have to do anything because it's all automatic. So if you sign up for, your Social Security benefits at 62, 63 or whatever, once you hit 65, Medicare sends you your packet in the mail with Part A and Part B already in there. And you don't have to take the Part B if you currently have health insurance from work, your work or your spouse's work, and your employer has 20 or more employees. So if you've already got that type of health insurance through, again, current work, not, the Affordable Care Act, Obamacare, and not a COBRA, not a retirement plan, but it has to be through current work, then you don't have to sign up for Part B, and you save yourself $174.70. And then later, a year, 2 years, 10 years, 20 years later, when you stop receiving health insurance from current work, then you go ahead and sign up for Part B and there's no penalty whatsoever. What's Part C? Part C is another name for the Medicare Advantage plans. So we'll talk about those a little bit. Those are the private plans that there's two options. There's Medicare Part C, and then a lot of politicians and probably myself as well don't like really being called Part C. It seems like it's part of Medicare, but they're private plans. And they kind of replace Part A and Part B. So you have to get all your health care through this Medicare Advantage plan. And they have, networks and pre-authorizations. So there's a lot of gaps in Part A and Part B. So that's why people get a Medicare Advantage plan. The other option is a Medicare supplement plan. And if you've watched any of my videos, I always recommend a Medicare supplement plan if it's in your budget, because you don't have to, get prior authorization. If the doctor says you need something, then you get it. You don't have to ask an insurance company whether you need it or not. And you can use any doctor in the facility, clinic, hospital in the country that takes Medicare. You don't have any networks. Okay. So Medicare Advantage or Medicare Supplement, those are the things that help you cover all of the gaps of original Medicare, or most of the gaps, some of the gaps, depending on what you choose. Then there's Medicare Part D. That's for the drugs, prescription drug plans. And those are also, you go through private companies. So you don't sign up for Part C at Social Security. You don't sign up for Part D at Social Security. You only sign up for Part A and Part B, as in boy. C and D is you find a Medicare insurance agent. I would prefer a broker, because a broker works for you. An agent usually works for the company. So they sell you what company they work for. So a broker, like I set up a network of brokers throughout the country that if you need help with C, D, supplements, the Affordable Care Act, Obamacare, anything like that, make sure you reach out to us. I'll put my stuff on the bottom here. So if you've got any questions, need any help with that, that's 100% free and no obligation. And full disclosure, if you happen to like the plan my people offer you and you enroll, that supports this channel here and all of the free information we provide. All right, so Medicare. So that's again part A. Part B, you sign up through Social Security. That's a federal program. What's the difference between that and Medicaid? Medicaid, and in some states they call a little bit different. California, they call it Medi-Cal in California, in different states. But Medicaid is it's a partnership between the federal government and the state governments, but it's administered at the state level. And Medicaid is essentially a needs base, a welfare based program. So not anybody can sign up. You have to have limited income and limited resources, and being disabled or aged, and then you can sign up for Medicaid. Okay. And there's different levels of Medicaid, QMB, QI, and Slim B, and a whole bunch. All the states, do a little bit of their own thing on the levels and what you're approved for. I've had people that, in one state, they were fully eligible for Medicaid. They moved to another state, same exact income and resources. They were not eligible in another state. So it kind of changes a little bit depending on the state. And you can have both. You can have your cake and eat it too, I guess. And this is, if you're eligible for Medicaid, then you can hopefully get what's called the Medicare Savings Program. And the Medicare Savings Program is Medicaid, the state essentially pays for your Part B premium. So if you have Medicare and your family, friends, remember, I always want you to watch these videos. Don't just think of yourself, think of everybody around you, your coworker, next door neighbor, the waitress down at the local diner. Think about everybody out there and share this information. So if people are having difficulty paying for their Part B premium, that $174.70, tell them, go down to social services, the state welfare office, Medicaid office, and apply for Medicaid. And if they're approved for Medicaid, they'll get other, benefits, health care as well, save a lot of money, and tell them to have the state pay for their Medicare Part B premium. So millions of people throughout the country, the states are paying for their Part B premium. So that's another $174.70 in your pocket. And if you have Medicare and Medicaid, that means you're dual eligible. And there are special Medicare Advantage plans that the government allows companies to offer. They're called dual eligible, Medicare Advantage dual eligible. And as I say, if it's in your budget, I always recommend a Medicare supplement. But if you have Medicare and Medicaid, then a dual Medicare Advantage dual eligible is definitely what you should really consider. There's a lot more cost savings in there depending on where you live, extra benefits, vision, dental, grocery cards, all the stuff you hear advertised. A lot of it is kind of bait and switch fraud. What they do is they take the best flex card, as they call it, in the country. In one area of the country, they take one that's like really, really good, and they advertise it over the entire country. And then you call them up, say, oh yeah, you're not, sorry, you don't live in that one little zip code. So Medicare has finally come down and put a squash to that and said, no, you can't do that whole bait and switch thing. So hopefully those crazy commercials will stop. But yeah, there's always bad actors out there. So that's kind of another reason I put my own little team together so I can monitor them and make sure they're doing the right thing. Medicaid under unwinding. This is a big thing that's been going on. Basically, what happened is during the pandemic, the federal government told the states, you can't kick people off of Medicaid. We've got this, pandemic happening, and people need health care. So the states weren't able to recertify people and check people whether they needed, they were eligible for Medicaid and all that. That just changed last year. So now millions of people are being kicked off of Medicaid throughout the country. And, they're scrambling. Unfortunately, a lot of times, I've worked in the belly of the bureaucratic beast for decades. Guess what? They make mistakes. So number one thing I would do, if you get kicked off of Medicaid and you think that's an incorrect decision, appeal that decision. But if you got extra resources, inheritance, you got a, legal judgment, you got a job, and oh yeah, I know I'm not eligible for Medicaid, then you have to find other ways to get your health care. And if you lose your Medicaid and you had a dual eligible Medicare Advantage, dual eligible plan, then you're going to lose that as well. So it's important that you transition, that you find another plan, um, other than the dual eligible, because that one's going to stop. So if you don't do something, then one day you're going to walk into the doctor or emergency room or something, and they'll take care of you. And then a week later, you'll receive a letter, with a bill for $10,000, and they'll say, "Well, I had Medicare." Yeah, but you lost Medicaid, and therefore that Medicare Advantage dual eligible plan, it doesn't work anymore. So it's important that you find something quick. So again, if you need help, got my phone number down there. Email me and give me your name, phone number, the state, because they're all state specific, and tell me, hey, I just lost my Medicaid, or I need to check to review my Medicare plan. I want a Medicare supplement plan. I want to check out. I'm 62. I'm retiring. I want to see if I can go ahead and get an Affordable Care Act, the marketplace, Obamacare, whatever you want to call it. So, so that transitions to, if you are not low income, low resource, then if you retire at 60, if you're a survivor, 62 for just regular retirement, or what are you going to do for health insurance? Or if you're disabled and you have to wait for 24 months for Medicare to kick in, what are you going to do? Well, that's where the Affordable Care Act, marketplace, Obamacare comes in. And there's a lot of fraud that's happening. The government has finally come down, where there's some, again, bad actors out there, agents and companies that have just put a whole bunch of stuff. I'm sure there's probably someone watching this right now that got scammed, where they click on some button on TikTok or Facebook or wherever, and then without their knowledge, their Affordable Care Act health insurance plan was switched, and now they lost their doctor, and they were going through treatments, and they lost their specialist because some agent somewhere in the country, when you press that button, they just went in there and changed a small little thing, changed your dollar amount or something, $1, and therefore they were able to change your plan without you knowing about it. And luckily, the government has come down on that, and they're yanking the licenses. So on a lot of people out there, a lot of agents, a lot of these these bad actors out there. So if you know anybody that fell into that situation, yeah, you tell them that they have recourse. Make sure they notify the CMS, the Center for Medicare and Medicaid Services, the marketplace, and tell them they were victims of fraud, and their plan was changed without their knowledge. And then you have to find another plan, to obviously to make up for it. So again, find an agent, again, preferably a broker, that that will work for you and shop all the plans and give you all your options. But if you don't know anybody, reach out to us. In terms of Medicare 2025, this is going to be a big one. This is a really big one, probably the biggest one in 10 years or more. Tons of changes. The way companies get paid, they're going to be paid less. They're going to be paid differently. Companies are the Medicare Advantage companies and all the rest of them have a lot more regulations. They're going to have to give out letters mid-year on, hey, you're not using your benefits and you should use your benefits. That's going to cost them money. What else? The drug plans. This year, there's $8,000 catastrophic for drugs. Next year, it goes down to $2,000. That's going to cost the insurance companies. And you say, it doesn't matter to me, I don't take drugs. Well, these CEOs of these Medicare insurance companies, they got to buy their yacht for Monaco. So, they're going to take that money out of some other places. So what's going to happen is in October, there's going to be massive changes, I think, for 2025. Everybody thinks so. And just don't, these insurance companies are hoping that you just let it ride. That, okay, it's still zero premium. I still have my doctor. Okay, I'll let it ride. They're hoping you do that. That's how you donate money to billionaires. Exactly, by doing that. They're hoping you don't check. Because the same company, you might like the same company, It's you got your doctor and it's zero premium and you think everything is good, but what happens usually is they degrade your plan, and all the hidden charges that you just might get hit with are hidden, and you don't find out until you find out, until you go to the hospital and find out, it's okay, it's $500 a night. So wait, last year was $100, there was zero. Well, see, you didn't check the details. So the insurance companies are hoping you don't check, and the government hopes you do check, and that's why they force these companies to send out what's called an annual notice of change every September. So when you get that packet in September, it'll go through all of the changes for 2025. So make sure you check that. And then find, again, someone that you know and trust. Again, reach out to us, send us an email now and say, hey, in October, give me a call, put me on your list. And in October, when the new plans come out, let's compare what's, for 2025 with my current plan and see if it's still the best plan for you. So that's important. So yeah, a lot of people are just going to let it ride, and they are going to be back here this time next year, and they said, Ed, I should have checked. I just got, charged for a MRI or a CT, or I went to a specialist. I got charged all this money, and I guess I should have checked, huh? And I promise I won't say I told you so. I promise. Okay. All right. I've officially made that promise. Okay. That's it for today. So I went through that relatively quick, only 16 minutes. So that's not too bad. Let's go ahead and get into some questions. So if you have any questions on all of that, or retirement, survivor benefits, spouse benefits, any and all of it, I'll be around here for another 40 minutes or so to answer all your questions. And if you don't have any questions today, you're done. You're watching this during the recording, make sure you subscribe. And that way you can find us in the future when you or your family or loved ones have questions that they need help with. Let's see here. John, if I want to double dip receiving benefits and staying at my job, when would I have to file, i.e. November, December, to get at least one payment the first year in order to receive up to 23? Okay, so double dip. Yeah, so sounds as though that you are currently working and you want to go ahead and start collecting your Social Security benefits too. So no problem whatsoever. As long as you stay under the annual earnings limit, because it sounds like your early retirement, if you're full retirement age, then you can make $1 billion a month and collect Social Security benefits. It doesn't matter. But if you're talking about early retirement, as long as you're under $22,320, then you can collect. And this is your first year, sounds like. So you're just going to start your benefits. So the first year is different. The first year, let's say in July this year, you make $1 billion from January till June. That's obviously over 22,000. But you make $1 billion from January to June, but it doesn't matter because you don't want your benefits to start till July. So starting July, as long as you're under $1,860 a month for the rest of the year, which is 22,320 divided by 12, they can move to a monthly test. So the first month you're under $1,860 a month, $1,860, and you stay under that for the rest of the year, you can collect Social Security benefits and continue to work. But you have to stay under the monthly. And then next year, there is no monthly. You have to stay under the annual earnings limit. And anything over, the limit for next year, whatever it is, $23,000, $24,000, Social Security holds back $1 for every $2 you go over. So yeah, it really depends is when you're going to be under. Let's see here. Hello from Louisiana. Hey, what's up, Louisiana? I am still working, and do I need to take Medicare? I work for Kaiser Permanente. So yeah, if you're 65 years old, approaching 65, and you are working and you have health insurance from that work, and obviously Kaiser has more than 20 employees, so you're good there, and you're happy with the plan. Some people even have it, even though they have health insurance from their work or their spouse's work, but they're just not happy with it. It's not a great plan. It's a high deductible. It costs too much, whatever the case may be. Some people still go ahead and sign up for Medicare. But in your case, if you're happy with that plan, you're good. Hello from West Hollywood. Hey, what's up? Can I collect on my ex-spouse if on SSDI and only 55, married over 10 years? Okay, So you are 55. If you are only 55, no. If your ex-spouse is receiving disability and they're 55, but you're 62, then you can collect. But if you're only 55, no. Hello from Northern Iowa. Hey, what's up? That's. I'm glad you covered such a confusing thing. Yeah, there's so much. I could have gone on for hours and hours and hours and hours and hours, but yeah, y'all don't want to hear that. But if you have any specific questions, make sure you ask. If you have just Medicare, no supplement or advantage, what happens to the FICA that I paid all those years? It I mean, that's your the FICA is the Medicare. So if you just have Medicare Part A and Part B, that's where I guess the FICA goes to. But that means you've got a few $1 million laying around in your bank account, because if you just, as a lot of people in the Medicare industry call it, you're running naked. If you just have Part A and Part B, then you better have a lot of money just sitting around, because if something happens, so for Part B, your co-insurance is 20%. So if you go into the hospital and you get a $100,000 Band-Aid, then you have to cough up $20,000. So that's why people get a Medicare supplement or a Medicare Advantage plan. Yeah, everybody that just has, just Part A or Part B, yeah, they regret it. Unless, of course, they're, super, super rich and they don't care anyway. So usually they don't even get Part A, Part B. They're super rich, don't. So wife and child are under my insurance from work. Wife is much younger and daughter is 5. When I take Medicare at 65, what will happen to my wife and daughter? Do I have to get them insurance on the open market? Yeah, unless, yeah, it doesn't sound like your job is going to do anything like that. So yeah, when you take Medicare at 65, but if you're working and you have health insurance from work, you don't have to sign up for Medicare at 65. So possibly in your case, I don't know all your particulars, but if you're going to continue working, let's say till 70 years old, then you don't have to sign up for Part A, Part B. You're still working, you have health insurance from work, just continue that. And then sign up for Medicare Part A and Part B when you're 70 years old. But if you are going to stop working at 65 and then you're going to sign up for Medicare, then yeah, you're going to have to find other places of yeah, for insurance. And if yeah, give us a call if you need help with that. Linda, if I retire early at 58, when I turn 67, does my check increase or does it stay the same? Okay, so yeah, um, so retire, you can't collect your Social Security benefits at 58. The earliest you can do it is 60 if you're not disabled. You can collect survivor benefits at 60, but you can collect regular benefits at 62. But basically, if you collect your early retirement at 62, your reduction is locked in. You can still get COLA increases, and if you continue to work and pay into Social Security, you might get a benefit increase depending if it's one of your high 35 years. But yeah, your reduction is locked in. So yeah, a lot of people think that is they take their benefits early at 62, and then when they hit their full retirement age, it's reduced up to the full amount. If that was the case, everybody would take it, and Social Security would be, yeah, they close the doors tomorrow. Canine Shepherd. Oh, it's Canine Shepherd. I think we solved one of your problems yesterday and got you a lot of money, right? And coming back for more. I like it. Good deal. Get all your things set up. But yeah, so just to answer your question there. Um, Robert, when I turn 65, required to have Medicare insurance, what is the cheapest option to meet Social Security requirements and the least cost? Yeah, so for Social Security requirements, the only thing is you sign up for Part A and Part B when you're first eligible. If you don't, then you'll get a 10% penalty for every 12 months you didn't sign up for Part B, and you'll get a Part D penalty. So you're probably talking about the private plan, so has nothing to do with Social Security. So in terms of covering the gaps of original Medicare, the cheapest, the cheapest immediately would be a zero premium Medicare Advantage plan. But the cheapest in terms of long term, if you ever get sick, then I and a lot of people would argue that a Medicare supplement plan, a plan G or a plan N, is probably the cheapest. But it's that's insurance. You're you know, if you knew what was going to happen in the future. So if you knew that you were going to live the next 50 years and you were never going to get seriously sick or injured or anything like that, then 100% zero premium Medicare Advantage plan, that's the best way. But if sometime in the next 30, 40, 50 years you happen to get sick or have an accident, then a Medicare supplement plan might be the cheapest and might be the safest, because you don't have to deal with insurance companies, denying your health care and all the rest of it. So yeah, it's if you want someone to help you out, go with all your options. Again, call me, leave your name, phone number, the state you live in, and tell us what you need, and we'll have someone reach out and give you all your options, and completely free, of course. When you say all the changes, does this mean original Medicare, or does original Medicare not have many changes? Original Medicare, yeah, original Medicare, no real changes. Well, I guess, yeah, the Inflation Reduction Act, that was the the Part D, the prescription drug plan. They changed. Remember before they used to have the donut hole. The donut hole's kind of gone away, but now they have catastrophic. So I guess CMS, the Center for Medicare and Medicaid Services, made a change, and that's the government mandated change that private companies can no longer charge $8,000 to people, for drugs up to 8,000. Now they can only charge up to $2,000. So that is a government mandated change that the insurance companies are going to have to abide by, and they're going to look for money other places, even though, again, people are going to say, oh, it doesn't affect me because I don't take drugs. No, it's going to affect you, because the insurance companies are going to look for other places to get that money, because they don't get to be billion-dollar insurance companies by giving away money. Oh, good. Renee Johnson. Hi, Ed. Can you explain what extra help is? Yes. Thank you very much. Thank you. Thank you. Thank you. All right. I should have added that in the original thing, huh? But I'm always trying to keep it relatively brief. Okay. The extra help with prescription drug, with your Medicare prescription drugs, the Part D, what I was just talking about, also called the low income subsidy. And it's like the easiest. I've taken millions of these. They're like the easiest application in Social Security. All right, so it's a kind of a low income welfare based type program. It's administered by the Social Security Administration. If you are having difficulties paying your drugs and stuff like that, you apply for this extra help through Social Security. Again, you can do it online, super easy, and it asks you about income and resources, because you have to have low income and low resources. And if you're approved, it helps you pay for your drugs, the cost of your drugs. Last year, they estimated that it saved people about an average of $5,600 a year. So it's probably going to be less this year and less next year, because the drug costs overall are coming down. Not the drug cost. That's another thing about the switch from 8,000 to 2,000. These drug companies, they're gonna look for other places to get that money, so they're going to increase everybody else's, possibly, the how much you charge, how much you get charged if you go to hospital, how much for an MRI. And if if you do take a drug and it was tier 1, it was 0, it might be tier 2 next year. So now you were 0 and now it's $20 a month next year, or $50 a month. And so, yeah, insurance companies are going to look for that money again. And it's not only that, there's a bunch of other pressures. The federal government, the reason Medicare Advantage plans were even started, because the government thought it would save money, rationing healthcare. They didn't want to do it, so they left it to the private companies to ration healthcare, which were more than happy to, do so to save money, to make more money. But it turns out that those Medicare Advantage plans, they're costing the government more than people on original Medicare. So the government is starting to reduce payments to those companies. So those companies are making less money. So again, they are, looking for other places. And again, they are hoping, all these big CEOs, billionaires in Monaco right now on their big giant yachts are saying, I hope everybody doesn't check their plans next year, because they're going to be in for a surprise. So please don't check your plans. Donate to the billionaires. But, be smart. And again, the government also wants you to check your plans to save as much money. That's why they make these companies send out those changes, the notice of change. So yes, if you or anybody you know are having difficulties paying for their prescription drugs, please tell them to call Social Security. Call the 800 number 772-1213 and apply for extra help with your prescription drugs. And if you have, in terms of, so if you have a Medicare Advantage plan, I keep saying, when the new plans come out in October for 2025, that's when you got to check. But you can actually, that's when most people, the 2025 plans come out. That's when most people change plans or review their plans. But if you have like a dual eligible, you're getting Medicare and Medicaid, you can change your plan several times a year. If you have extra help with a prescription drug, you can change your plan several times a year. If you move, you can change your plan. If there is a 5-star plan in your area, you can switch to a 5-star plan. So a lot of people think, oh, I've chosen it, so I'm stuck. I can't do anything till October. No, there's usually a lot of, as I always say on all my videos, there's exceptions, the exceptions, the exceptions. So again, give us a call and we can see if you can change. And at the very least, tell us that you want us to help you review in October. Good evening from the Philippines. Hey, what's up? Um, why are they taking my Medicare away from me since I told my local Social Security office that I want to file for divorced spouse benefits? I have no idea. I've never ever heard of that before. Um, yeah, that makes no sense whatsoever. Oh, maybe. Yeah. Okay. It makes no logical sense, but illogical in the sense of someone at your local Social Security office doesn't know what they're talking about. So you were probably receiving disability and you're receiving Medicare based on your disability. And now that you want to get some extra money by getting spouse benefits, they say, well, you're switching from disability to spouse benefits. No, no, you're not. You're adding spouse benefits on top of your disability. So it's called a dual entitlement. Yeah, I think I have the reference number. I'll put the reference, the policy reference number, um, on the yeah. I'll put it on the description of the video. Um, and if I don't, send me an email and say, "Hey Ed, you forgot," to put the reference number. I'll put the reference number, and that way, when you go back in there, you just hand them the reference number RS0002 whatever it is, and then the person will disappear for 10 minutes and come back and say, "Oh, yeah, you're right." So yeah, Social Security is a 27-year low in terms of staffing. So there's so many people out there that are not getting the benefits they're entitled to because they go to a Social Security office and they hear that, they're eligible for this. They go there, the Social Security and the new Social Security employee that was just hired last month tells them, no, they don't have that. And people contact me all the time and said, Ed, you told me to go in there and file for independently entitled divorced spouse, and the person said they don't have that program anymore. And then I send them the reference and they get it fixed. So that's why I am here in my semi-retirement doing all this. So y'all get all your money. That is my new mission in life, to get your money. So, and I can't do this alone. I need your help. This is a team effort. I need you to subscribe, share, like, all that stuff. And that teaches this stupid, these computer algorithms that this is important stuff and it needs to be sent out. Cat videos are awesome, but yeah. All right, Purple Love. My sister's husband, Purple Love, I know it's an artist previously known as Prince, or reference. My sister's husband passed away. She had Medicare and his insurance. Now they want her to pay $300 a month to keep her husband's insurance. Should she keep Medicare and use a Medicare supplement plan? Yeah, if she's okay, so she had insurance through a kind of her husband's retirement plan or something like that. So if she can stay on that forever and she's happy with it and she's guaranteed it's going to stay forever, then maybe keep that. But if she doesn't like that, it's too expensive, or she's not certain it's going to stay around forever, then she has to sign it. She has to, do Medicare, or she gets penalized when she gets signed up later. So yeah, it's a completely her decision. For Part B, it's the $174.70. A Medicare supplement, the average throughout the country anywhere from $80 to 110, 20, $30 a month, depending on what state you're in. If you're in New York, it's like 2 or 3 times that. Um, but that's because New York is awesome and they have very tough laws that insurance companies can't discriminate, but they didn't pass the law to where they couldn't discriminate based on price. But anyway, um, the whole country should have those laws, and then all the prices would come down for everybody. But anyway, yeah, I would definitely have her check that out. But if she can't afford a Medicare supplement, I wish everybody could afford a Medicare supplement. I think it's the best thing for them over the long term, but a lot of people just can't afford it. So Medicare Advantage is another option, those zero premium plans. But the thing the reason I'm hesitant about the Medicare Advantage plans is, again, I don't like the pre-authorizations where insurance company gets in between you and your doctor, and the networks are always changing. And there's zero premium now, but who says they're going to be zero premium 5 years from now, 10 years from now, 20 years from now? Are they sucking everybody in with the zero premium and the shiny little whistles and stuff, and then 5 or 10 years from now they're going to jack it up to $100 a month for premiums? I don't know. Nobody knows. So, and at that time, you'll say, well, at that time, I'll just switch to a Medicare supplement. Yeah, no. Yeah. Unless you're healthy. The only time you can switch to a Medicare supplement without health underwriting is when you're 65 or you're new to Medicare Part B. So anytime, basically, there's some exceptions depending on your state and everything. But yeah, other than that, you have to be healthy in order to get a Medicare supplement plan. So yeah, I 5 years from now, hopefully, if I'm still here doing this thing, if I'm still up, if I'm still above ground, I'm still going to be here for y'all. But 5 years from now, I'm just not gonna. Yeah, it's not going to be. I hope nothing terrible like that happens, but yeah. What exactly is covered by A and B? Okay, so Part A covers your hospitals, but there's gaps in there. So, like if you go to a hospital this year, your deductible is $1,632, and that's multiple times a year. Could be 3, 4, 5 times a year. You go to a hospital, and a couple of months later, you go to a hospital again. They'll charge you another 1632, another again, another. So, and then there's other gaps in there. And then Part B covers your doctors, your outpatient type stuff. So if you actually have the surgery, the surgery is covered by Part B. Your doctor's visits and tests and all that is covered by Part B. And the big one there is that's Part B covers 80%. So if you have a $100,000 surgery, Medicare pays $80,000, and you have to cough up the other $20,000 in cash. So that's why you should get some type of Medicare Advantage, Medicare supplement, or win the lottery. All right. Yeah, I don't want to do any advertising for any companies. Let's see here. Did they change the redundant law? We're talking the government here, so I think all laws are. But when you are on SSDI as a child, but you are not now an adult and still can't marry because the government will view you as an adult and take away your benefits. No, yeah, you're talking about the disabled adult child law, that if you're a disabled adult child, you cannot get married. That is a fact, unless you get married to another disabled adult child. So yeah, once you are receiving disabled adult child and you get married, they figure you're no longer a child anymore, unless you marry another disabled adult child. Yeah, so that law is still there. I could keep FEHB, that's Federal Employees Health Benefits, and or Medicare Part B when I retire, but probably can't afford both. Is FEHB safe for Congress? Is Medicare? I'm single, about to retire. Yeah, yeah, FEHB, you don't have to sign up for Part B, Part A or Part B. They're not mandating anybody yet. Like I think the post office is. They just changed that this year for new people. Yeah, so that's the decision you'll have to make, whether you just want to stay on FEHB. But remember, if you get off FEHB, Federal Employees Health Benefits, and go to Medicare Advantage with a Medicare supplement or something like that, once you get out of there, then yeah, there's no going back. Cadillac Jack, hey, what's up? Keep the information coming. Appreciate it. Yeah, appreciate you. Always supporting. Awesome. Why do you not receive your delayed retirement credits until the following January if you are past your full retirement age, unless you're turning age 70, and then do you receive the full amount? Yeah, you get it. It's just, yeah, um, good comments. I like it. Someone that pays attention to the details. You get it. It just takes a while for them to do it. You get like an entire year. It depends when you start your benefits and all that kind of stuff. The Social Security computer system is based on Fortran and COBOL. It's from the 70s. So the Social Security is always looking for people that can code that language, and they're all 200 years old. So you get like the full years. So you get like, so if you do like 69, then you get you retire at 69. You get maybe the 67th, that year, the full year, the 68. But if you do it like in the July when you're 69, then that final part, the computer just doesn't catch it until that the following year. But you'll get all your benefits. It's just a delay in getting it. It's because the computer system is just old. Joseph, just want to say great vid, great info coming from a person who helps the rules for A101, EF101, McCade. Oh my gosh, yes, an A101 and EF101. EF101's never worked. McCade, don't even use madcap application. Okay, so this is a retired Social Security employee here that yes, those are all the internal acronyms for all the computer systems. Yes. Wow. Okay. Wow. That brought back flashbacks there. Can I collect widow's pension at 60 and still work full time till 62? No. Well, it depends how much you're talking about work full time. You're still under the annual earnings limit of $22,320. So if that's your full time, then yes. But yeah, anything over that, Social Security holds back $1 for every $2 you go over. So and when you turn 62, okay, hopefully you got this strategy. You're collecting survivor benefits now. Let's say you're going to get started. You can collect survivor benefits, and then when you get 62, evaluate your benefits on your own record. And even if it's a little bit more, you might want to just stay on survivor benefits, because the survivor benefits, you'll continuously get that check every month. But because you're not touching your own benefits can increase every month until 70 years old. So stay on survivor benefits as long as you can. And then, every now and then check your own benefits and see how much it is and say, oh, it's $200 a month extra. It's $300 a month. It's $500 a month extra. And then when it's at a good number, jump on over to your own benefits. All right. Let's see here. Donna, when I signed up for extra help, I was approved in 2 weeks. Yeah, see how easy that application is? It's super, super easy. There's so many people that are not receiving, millions of people are not receiving the extra help. And this year, actually, I'm going to do a video in a few days about this time. May and June is when Social Security sends out a letter specifically talking about that. So they send out a letter to everybody's that is receiving Social Security benefits, but at kind of a lower amount, around 1,500 or so ish, and say, hey, just kind of FYI, there's this program, extra help for prescription drugs out there, and you might be eligible for it, because Social Security doesn't know what other kind of income you have coming in. If your spouse is working and making 50, 60, 70, 100,000, then you're not eligible for it. But Social Security doesn't know, who you're married to and what other 401 pensions you have and all that kind of stuff. So they just send out that letter to everybody. So I'm going to talk about that in about a week or two, and hopefully we can get more people signed up for that and get some more people save some money and make their life easier. Okay, yeah, I kind of avoid recommended companies there, but thanks for the information. I take completely neutral, which all brokers, again, I only allow brokers into my network. And basically an agent is, as I always say, the old Henry Ford thing, you can have any color car you want as long as it's black. So when you go to an agent, whether it's auto insurance or health insurance or anything, and they work for company X, Y, and Z, guess what company they're going to recommend? X, Y, and Z. But a broker, looks at all the companies in your area and says, is completely neutral and says if they're not neutral, then they don't work for me. And then they say, hey, based on your doctors and your prescriptions and your health and all this other kind of stuff, here's my top 1, 2, 3 recommendations, and then you make the final decision. Julie, I will be 65 in September. I collect Social Security now and have Medi-Cal. What do I need to do, or who do I call to make sure I get the help paying for my Medicare premium? All right, good deal. Yes. Okay, so you have Medi-Cal, and just let Medi-Cal know, contact them and say, hey, you kind of know how old I am. I'm not sure how good their computer system is there. And I'm going to, because you're going to get your bill for Medicare in August, because for Medicare, you always pay a month early. So they're going to take Medicare out of your Social Security check starting in August. So I would probably contact them now and say, hey, I'm going to lose $174.70 here very, very soon. Please, do your thing and make sure I get that Medicare savings program. Make sure you pay for my Part B, because it's good for the state too, because they get to move costs over to the federal government. So they like doing this. But a warning. We're talking about 3 different computer systems. We're talking about the state, we're talking about Social Security, and we're talking about Medicare. So sometimes, well, almost all the time, if you pay yours in August, they take it out of your check in August, and then the state of California goes in there and pays for August. The computer system will eventually, usually takes about a month or two. The computer system will recognize there were 2 payments for that 1 month, and then they'll kick back one and put it back on your check. So just keep an eye on that. Keep an eye on that. So you don't want to lose that $174. Do rack up 240. Yes, yes, Diana. So the Medicare Supplement Plan G and Plan N, particularly the Plan G, that's the only charge it has, is if you go into and you have a $1 million operation or treatment, you pay $240, and that's it. Done. You pay obviously your monthly premium, and you have to pay your Medicare Part B, regardless. But yeah, in terms of $1 million, you pay $240. So I've had a lot of people, unfortunately, you get cancer or something like that, and they were worried about the treatment and the drugs and the side effects and stuff, but they didn't have to worry about the financial part of it. Hundreds of thousands of dollars of treatment. They got a bill for $240, and they were good. Please explain what a cancer rider is, and if you need to add it to a supplement plan or advantage plan. A supplement plan, no. With a cancer rider, so there are hospital indemnities and accidents and cancer and stuff like that you can add, that if the underlying insurance is not sufficient enough, you can add, extra cancer in case you've got, kind of a history in your family of it. But you don't need it with a Medicare supplement, because again, $240. You don't need, to pay anybody to cover that $240. But if you have a Medicare Advantage plan, then yeah, a lot of people get a rider, a cancer plan, or particularly a hospital indemnity plan. A hospital indemnity plan is, again, if I keep saying again, but I've talked about this in previous videos, but I didn't talk about it, so I'll just say it for the first time. So if you have a Medicare Advantage plan and your hospital charges on that is, $400 a day or $500 a day, and you're someone that goes into the hospital, or you think you might go in the hospital, then what people do is they get a hospital indemnity, and they pay $10, $20, $30 a month, and that company pays out the hospital charges. So that is something you might want to check out if you have a Medicare Advantage plan. But if you have a Medicare supplement, you're good. I'm on a Medicare Advantage dual complete right now. If I move out of area, instead of changing to another Medicare Advantage, could I go back to Medicare if I don't qualify for Medicare Advantage? Um, yeah, if you move to a completely different area, particularly states, and you lose you could very well. There's a lot of variables there, but yeah, before you move, give us a call, email me, and I'll have a member of my team reach out to you and find out what area you're in, what area you're going to move to, what you have, all that kind of stuff, and give you all your options. And you know, the changes, you know, as I always say that the Social Security Administration over 20,000 pages of policy to change your plans from Medicare Advantage to supplement and special enrollment periods. And if it rains a little bit much in this area, it snows a little bit and too much in that area, there's special enrollment periods for that. And it's just crazy. So rather than, wondering and not making the decision when you need to, just reach out. It's free. They don't charge you anything to check. Are you covered with your Medicare plan when traveling in all 50 states? You are covered with Medicare Original Part A and Part B. That's anywhere in the country. Um, you know, 95+% of doctors and hospitals and clinics take Original Medicare. If you're on a Medicare supplement plan, yes, absolutely. You can go anywhere. I was to say, if you're on a Medicare supplement plan, your network is America. Again, the same people that take Original Medicare. If you're on a Medicare Advantage plan, you've got all the networks and all the rest of it. But some of the Medicare Advantage plans, they're offering these kind of passports where if they're like a national, Medicare Advantage plan, so they have doctors throughout the country. So it depends on your particular plan. Some of them, you have to call them up and say, hey, I'm going to be traveling from Texas to Florida, and they'll give you like a passport type thing. And then if something happens when you're in Florida, they can cover you. But that's only for travel. If you move, then you have to change your plans. Oh, Megan is so awesome. I had it kind of right. I was saying RS00202.005 for Social Security disability and independently entitled divorced spouse. And that also counts for, yeah, that reference is Social Security disability and any spouse benefits, whether it's independently entitled divorced spouse, surviving spouse, divorced spouse, current spouse. So thank you very much. Thank you, thank you, thank you. So that's the reference. You go in there armed to the teeth. And when the person at the front window tells you, no, you can't do that, you can't have disability and spouse benefits, then you show them that reference. And again, they will disappear for 10 minutes and come back with a sheepish look on their face. And you tell them, Megan hooked me up because she is awesome like that. Thank you, Megan. Thank you, thank you, thank you. All right, Carol. What a team we got going here. This is awesome. Give me shivers. How do insurance companies profit off healthy people? No drugs, no chronic diseases, conditions, minimal lab visits. Exactly that. That's how they make their profits off of healthy people. Just like how the auto insurance companies make their profits off of people that don't have accidents. So yeah, if you're healthy, you're paying your monthly premiums, and that pays for everybody else. So Sandy, I'm dual eligible and I feel blessed to have coverage I have. Yeah, the like I, again, I am 100%, Medicare supplement. If you can afford it, if it's in your budget, I highly recommend that, unless you know the future and you'll never get sick. But if you have Medicare, original Medicare and Medicaid, then yeah, never supplement. A Medicare Advantage is the way to go. However, Sandy, this is something that most agents, brokers, well, my brokers will tell you, but that won't tell you. If there's ever a situation where you have to get a lot of home health care, and what we see happen is agents out there, they try to sell, sell, and they'll even sell people that have home health care. And what happens is home health care, the Medicare Advantage company, whichever one you have, they will say, yes, we cover home health care. We can send someone out to your house and do a little bit of this and do a little bit of that and help you with this and help you with that and stuff like that. And that's what it is on paper. It's in the book, in their policy book that they offer that. But in reality, quite often is those home health care agencies in your area don't like Medicare Advantage plans. They prefer Medicaid. And because Medicaid pays more and they pay faster. So if you've got a bunch of Medicare, or excuse me, a lot of home health care agencies in your town, 20, 30, 40, and you have a Medicare Advantage plan and you say, hey, I need help with, home health care, this, that, or the other, they'll say, yeah, no, no, no. Yeah, we're contracted with that company and we're allowed to do it, but we're so busy and taking care of Medicaid, we make some more money and they pay quicker and stuff like that. So if that ever comes to it, anybody else out there that that someone's trying to switch them to a Medicare Advantage plan and they already have Medicare and Medicaid, if they have home health care, sure, there's a $20 or $100 grocery card attached to that Medicare Advantage plan, but maybe depending on your area. But do you want to lose your home health care people that have been coming out to your house for months or years? Because as soon as you tell those people, it says, yeah, I got this shiny, cool grocery card that I'm going to get. And because I just signed up for a Medicare Advantage plan, and that person might say, well, then yeah, we can't come out anymore. Our company doesn't like those. And sure, we're contracted and we're in the books that we can take them, but yeah, no, we're just too busy. Sorry. So yes, think about that. Think about that. A lot of people have been lost their home health care because people are not being honest. Yeah. So it's yeah. Why is staffing so low? Does that have to do with COVID? Um, yeah, I mean, possibly. I retired, it was a couple of years ago now, and then I took an early out. I'm still relatively youngish, although it doesn't look it. I took an early out, and about a week or so after I left, they contacted me and said, would you consider coming back? Too many people, they offered an early out and too many people jumped on it and yeah, left. And money. And it's getting worse because, this is in the number one year in American history. More people are turning 65 this year than any time in American history. And so Social Security is just completely inundated. And yeah, and unfortunately, we are making it worse because we're finding money for people every single day that didn't know they had it, and they're going into the Social Security office. And so we're making it worse, but we're making individual lives better. We're making it worse for Social Security, but we're finding millions of dollars out there for people. So yeah. So here, I did a video on how to improve customer service to Social Security. I think it got less views than any video I've ever done. So if you go down to the local Social Security office, I'm going to try again here. If you go down to your local Social Security office and there's a 2-hour wait, or nobody picks up the phones, then call your politician, your senator and congressperson that goes to Washington D.C. and say, hey, I just went to Social Security, and it's like a 2-hour wait, and or I've been waiting 2 years for my disability to be approved. you know, I think local politicians need to feel the pain of their local offices, and they need to go down there and say, okay, yeah, look at the line. Okay, now what are you going to do about it? What are you going to do about it? Stop going back and, talking bad stuff about Social Security and stuff like that. Fix your local office. Everything is local. All politics are local. So make your politicians feel the pain that you dealing with the Social Security. And, I think that would be a big step. Cindy, I have Medi-Cal share of costs with $1,300 deductible and extra help for Part D. Was 65 in April. Social Security says state will no longer pay Part B. I don't have a supplement. What to do? Yeah. So I would definitely. So a cost of, so there's different levels of Medicaid in California. They call it Medi-Cal, but there's different levels of Medicaid. Some of them, they'll pay for your Part B. If it's a QMB, a QI, SlimB in most states, they'll pay for your Part B. If you have lower levels of Medicaid, then they won't pay for your Part B. And some states have this cost share of costs where you have to pay, like, Cindy has to pay the first $1,367 before Medi-Cal will even kick in, and now they're not going to pay for the Part B. So um, an option would be to sign up for a Medicare Advantage plan with a zero premium and get some of your other costs covered there. But there's a lot of variables there. So reach out to someone you know and trust, and to give you all your honest options. So send me an email or call me, and if you want us to help. All right. Let's see here. So we are at an hour. So um, we're running out of time. Let me get to someone, one or two people that haven't been here before and never asked any questions. I think this is a new person. Applied for my husband's Social Security 2 months ago. Still have not heard anything. How long should I wait before I contact them again? Yeah, 2 months. Yeah, that if it's just applied for my Social Security. So if it's just a current spouse or divorced spouse or something like that, that one should have been approved immediately. It Yeah, I've done hundreds of thousands of those, and they take, if you got all the proofs and everything, in 2 minutes they're done, adjudicated, done, checks in the mail. But maybe the person that took it is a brand new employee, and those employees have to have reviews by their experts. So that case might be under review, but 2 months is way, way too long. So I would contact them today and say, hey, or tomorrow and say, hey, 2 months is way, way too long. You won't lose your benefits. If you were entitled 2 months ago, they'll pay you 2 months retroactive. You're not going to lose your benefits, but you want your money. So there's that. Uh, let's see. Thank you for doing this. What if you were married for 11 years, but on paperwork it's less than 10 years? Yeah. It's got to have documents, marriage, divorce, unless you were in those are all, marriage and divorces are state regulations, state laws. So if you live in a common law state, then, might be different. Okay, Cat J, Doctor, this is the info you need. RS is okay for the dual entitle overview. Yes, okay. All right. So there's a couple of the other reference there. There's one in there that I think it was the previous one, the 202, that specifically says, anybody that receives retirement benefits or disability benefits can get spouse benefits, and the reduction is not on the disability. It's on the survivor. So if you start your spouse benefits at 62, it's reduced, but obviously your disability is not reduced. It's based on that. So all right. Yep. So I'm completely out of time here. Let's see. If we've got any other. What age is retirement for my sister? She was born in 1965. So yeah, you can start your early retirement at 62 years old. Full retirement age for anybody after 1960 is 67 years old. What is the extra help program called? It's called the extra help program, and you just apply for Social Security. It just applies Social Security, and you can actually do it online too. It's pretty easy online. Okay, here's the last one. I've never seen this person before. Legacies of I don't think. Okay, maybe I don't remember. Social Security reps tells me overpayment due to miscalculated back pay. Kicker is I tried to work while waiting on decision. Worked 9 weeks. Went over SGA. Employees tell me not only those months but 3 months. Okay, so I would definitely request a reconsideration on that, because they might be able to write that off as an unsuccessful work attempt, at the very least, where it's basically said, hey, you're waiting forever to get your Social Security disability money, but you had to pay the rent and eat and all that kind of good stuff. So you tried to go back to work, tried to do the right thing. Social Security always, wants people to go back to work if they're able to. So that's what you did. And so they might be able to write it off as an unsuccessful work attempt, or if they started your benefits before that as a trial work period, or so I would definitely request a reconsideration at SSA 561 and see if have someone else in that office look at it again, and see if they can save you any money, or delete that overpayment. So all right. Thank you all. Thank you, Megan. Thank you, everybody, for helping with the Palms references there. I sure appreciate it. All right. I will be back tomorrow. So if I didn't answer your question, make sure you join me tomorrow and we'll do it all again. Y'all have an awesome night and